Today we're giving medication for Ms. Millie Larson, date of birth 1/1/1936. I'm going to access the MAR to make sure the medication is that ordered matches what I'm about to do. So by accessing her MAR, I'm going to verify Millie Larson 1/1/1936, MRN 123456. She has no known allergies, and the medication we're giving right now is the furosemide 20 milligram by IV. Every IV push every 12 hours. We're going to administer it over 2 minutes. We will flush with 3 mLs of normal saline before and after the dose. Time to give the medications now. It's for edema and blood pressure. That is my first check. Gathering my material, I'm going to check my packaging on the medication that I've received from the pharmacy, and I'm going to verify that the expiration date as well as the medication. So I have the furosemide, and it's 100 milligram, and there's 10 milligram per ml in this vial. We are giving her 20 milligrams, so that's going to be 2 mLs. Okay, we're verifying the expiration date 10/20/29, and I'm also going to verify the expiration dates on my flushes, and they are 0.9% sodium chloride flushes, and I have 2 of them. They are 10 milliliter. The expiration on each is March 1st, 2023. Now I'm going to do my second check of her medication, or the MAR. Okay, the patient's name is Millie Larson. Her date of birth 1/1/1936, MRN 123456. She has no known allergies. The medication that we are giving is the furosemide. It's going to be 20 milligrams, which is 2 mLs, and we're going to give it over a 2-minute period. The time to give the medication is right now, and she's not allergic to any medication, and the medication is being given for edema and blood pressure. So I'm going to verify once more because I'm going to draw the medication up, and that's again Millie Larson. Date of birth is 1/1/36. Medication, MRN 123456. No known allergies. We're giving her furosemide, the 20 milligram IV push. It's going to be every 12 hours, so we're going to do it over 2 minutes. The medication is due now, and it's going to be we're going to be following it with 3 mLs of normal saline, and before and after. It's for edema and blood pressure. Following aseptic technique, I am going to prepare the medication. I take a alcohol pad and I wipe the top of the vial. What I have on my site here is a 23 by 1 inch needle that I'll be drawing up the medication with. I'm going to be sure to make sure rather that there are no bubbles in my syringe, and there are not. Okay. I'm going to engage the safety, remove this, and place it in my sharps container. I will now label my syringe. Furosemide, 20 milligram, 2 ml. This is for Millie Larson, 1/1/1936. And now I will, using aseptic technique, I'm going to waste my sodium chloride or my saline. I have 7 mLs that I need to waste because I'm going to be giving 3 mLs before and after the administration of the furosemide. And I have no bubbles in my syringe. I'm recapping it using aseptic technique. Doing the same with my second vial. I'll be wasting 7 mLs. Ensure there are no bubbles in my syringes. Okay, there are no bubbles, and the next thing I'll do is my hand hygiene and go on to the patient. Hi, my name is Cheryl. I'm your nurse today. You're Miss. Can you please verify your name and date of birth, Miss Larson? Okay. So that's Millie Larson, 1/1/1936. Are you allergic to any medication? Great. So my name is Cheryl, and today the medication I have for you is furosemide. It's 20 milligrams. We're going to put in via your IV site, 2 milliliters. Okay. And how we're going to the reason we're going to do that is because of your blood pressure and your swelling, edema. Okay. And what we're going to do is the first thing I'll do is I'm going to assess your IV site, and then I'll take an alcohol prep pad and I'll clean the hub. Then I'm going to put 3 mLs of the sodium chloride or saline flush through your IV to make sure that your IV is patent and everything like that. We'll push that through there, okay? Afterwards, I'll administer the furosemide over a 2-minute period, okay? And then I'll take it off again. I'll clean the hub once more. After I've done that, I will put another 3 mLs in, and I'll put of the saline, and I'll push that through slowly. Then I'll clean the hub once more, and then I will just see how you're doing in regards to the medication, and then we'll be done. Do you have any questions for me? Actually, I'm going to assess it again once more afterwards, and then we'll be finished. Do you have any questions for me? Great, let's begin. Okay, so the first thing I'm going to do is assess your site. Does that hurt? Okay, it's good. So there's no swelling, there's no pain, there's no redness, there's no infiltration or any signs of discharge or infection. Okay, so the next thing I'm going to do is I'm going to get an alcohol pad. I'm going to clean your hub, being careful to make sure that I do it for about 5 to 10 seconds. Okay. And then the next thing I'm going to do is I'm going to take this flush, being careful not to touch the tip. I'm going to insert it into the hub. And this is the 3 mLs of the sodium chloride, okay? We're going to do that slowly. Good. We can just get rid of this over here in this trash receptacle because it is not a sharp and we're allowed to do that, okay? Then I'm going to get another alcohol pad. And I'm going to clean the side, your hub one more time. Then I'm going to administer this medication, the furosemide. It's 20 milligram or 2 mLs. And we're going to do it over a 2-minute period, okay? So I'm going to put this right here on the hub. And we're going to start now. We have 1 ml administered. And 2 mLs administered. Okay, so then we'll get 1 more alcohol pad here. And then we're going to clean the hub one last time. We're going to administer the last 3 mLs of the sodium chloride. We'll do that kind of slow there. Okay. All right. And we're going to get the alcohol pad again. Careful not to touch the hub. And we're going to clean it one last time, or one more time. Okay. Now we can dispose of the syringe in the trash because it is not as sharp. In the trash here. Now I want to assess your site here. Okay, so there's no redness, no swelling. Are you having any pain? No, good. There's no infiltration, no sign of infection, and it looks like everything looks good there. Okay, do you have any questions for me? Good. So I'm going to put the call bell in reach, and then I'm also going to check your side rails, make sure that they're up and you are safe. There's your call button, and here are the side rails. Okay, if you need anything, just press the button and call us, and we'll be in here to see what you need. Okay, have a good day.